When we talk about the structure of a patient-centered medical home, we really need to think about several components. The first component would be the framework of the medical home. And the framework is really looking at the principles of patient-centered care and team-based care and saying, how do I build the literal pieces of my medical home so that they deliver on those principles? Advanced access, care coordination, managing transitions of care. We start to think about those and other principles around the literal inside the health system medical village with my medical home at the center. And if I'm going to be patient-centered, I'm going to build that framework around everything the patient needs, not what we need, but what the patient needs at the core of that framework structure we're building about what do the contracts look like, for instance. Are they going to be all about language that talks about the patient's needs and desires and all about how we deliver value in every one of those metrics around what the patient wants and what the patient needs? Kind of know that the patient needs the right diagnosis at the right time and then the right treatment. But on the side of the coin that's all about what the patient wants, well, now we're talking about something a bit different. They want access. That's what they put in their top 10 list about what matters most to them about getting great health care. They expect the right diagnosis. They expect the right treatment. So the framework is about putting people in place and using tools to really drive those principles of patient-centered, team-based collaboration. As we build that framework around those value-driven contracts, we start to see that the order of the day is how do we keep one foot in the volume-based world and excel at those issues that drive success and sustainability in value-based healthcare while we keep a foot in the volume-based world. We can't ignore throughput issues and efficiency issues and how we build our pieces of this medical home. But we also have to drive towards change that means fundamentally about how do we deliver value? How do we measure the quality? And then how do we deliver it at a reasonable cost? That's value. And that we will take up in the other pieces of the medical home, which would be about team-based care. And then finally, how do we deploy technology to support all of that?